Welcome to our quick tips videos. Today is part one of our cognitive diffusion videos. So what do we mean when we say cognitive diffusion? Well, in cognitive behavioral therapy, one of the big things that we look at is how the way that we think about things influences how we feel, which then influences how we behave and further influences how we think. And it goes around and around like a cycle. So when we think of being fused with our thoughts, what we're talking about is when we dive in deep with those thoughts, we feed into them, and they fuel the cycle of that thoughts, feelings, and behavior. So when we talk about cognitive diffusion, what we're talking about is how to get some distance from your thoughts so that they aren't necessarily automatically perceived as reality. So for example, if you're feeling particularly stressed or depressed or anxious or overwhelmed, what you want to do is pause and notice, what thoughts are you having? You might be having thoughts like, this is too hard, I can't handle this, or this is too overwhelming. And those thoughts in and of themselves feel really hard and overwhelming and will perpetuate and fuel those feelings of depression, overwhelm, and anxiety. So in cognitive diffusion, what we're trying to do is to get distance from those thoughts. So the first diffusion strategy we're going to talk about today is called thought labeling. This is the first step in learning how to diffuse from our thinking. Now, these things are not going to make your anxiety or depression or overwhelmed feelings go away overnight. These are tools in a tool belt that can be used together that will help the more that you use them. So they do take practice and time, so you're going to have to work at them for a little while before you'll get good at them. But if you stick with it, I know that you can do it. So what thought labeling does is that we pause and we notice those thoughts. This is too hard. This is overwhelming. I can't handle this. And what we do is we put the phrase, I'm having the thought that, in front of those thoughts. So now, instead of saying, this is too hard, we would say, I'm having the thought that this is too hard. Or instead of saying, this is overwhelming, we would say, I'm having the thought that this is overwhelming. Similarly, we might say, I'm having the thought that I can't do this. It seems kind of silly and small, but just that simple phrase of saying, I'm having the thought that, gives us some distance from these thoughts and helps us begin to realize that although they may feel true and absolutely have some truth to them, they don't necessarily have to be our complete truth in that moment. Now, something else that you can do is to actually write this down. So if you have time and you're in a space where it's possible, when you're noticing those depressed and overwhelmed feelings or anxious feelings, pause for a minute, notice what thoughts you're having, and then jot down the I am having the thought that, and then fill in the blank. That act of writing it down also provides another layer of diffusion or distancing from our thoughts. Now, this works really great with thoughts, but you can also do it with feelings and behaviors as well too. So we might say, I'm having the thought that this is too hard. I'm having feelings of being overwhelmed. I'm having the feeling of being frustrated. I'm having the feeling of being anxious. And then we might also label our urges. I'm having the urge to avoid dealing with this, or I'm having the urge to just put it off and not deal with it at all. All of those would be labeling techniques as well too. So over the next couple days, as you're noticing yourself feeling depressed, anxious, or overwhelmed, give this thought labeling a try and see if over time it helps you to start to separate from your thinking. I hope this tip has been helpful and look forward to seeing you next time for part 2 on our cognitive diffusion.